Hello, everyone. With me on the Let's Talk Public Health Show, I have Dr. Chioma Nwamaka. She's an advocate, an influencer, the founder of Smile With Me Foundation. She's someone I find really amazing and spectacular. And we're going to be asking a series of questions, and I just hope you guys enjoy this podcast. So, welcome, Dr. Chioma.
Thank you, Loretta.
So first, you wear multiple hats. You're a doctor, you're a speaker, you're a sexual and reproductive healthcare advocate, you're a content creator, and still a healthcare influencer. Did you know you were going to do all these many things when you were in medical school?
Okay. Thank you so much for that question. I think the best way I would answer that is firstly to start from the beginning. Medical school for me was just like everybody being in medical school, every medical student. So we just knew we were just going to graduate, go through the house job, NYSC, and then if you're interested, residency. So that was the dream for me, you know. Back in school, I was very, very passionate about dermatology. And that was just it for me. Everybody who knew me knew that I had a keen interest in dermatology. But one thing I knew for sure was that wherever I found myself, whatever I was doing in the next 10 to 15 years, 20 years, I was going to be interested in policy making around healthcare. I wasn't just going to be the average doctor sitting down and expecting things to happen. I was definitely going to be part of those who were making things happen, because the medics over time have always been seen to be quiet, and then we normally just let things move automatically. We're not intentional about our moves. We just let the whole world direct us, or life direct us. But I just wanted to be an active player in my own life's decisions. And so while I didn't know I was going to wear this many hats, as you called it, I don't see them as many hats because they're basically the same thing. But while I didn't know I was going to be doing this many things or going this route, I definitely knew that I was going to be, as I said, an active player in healthcare, and I think that's what I'm doing or where I'm headed.
That's amazing, because you are obviously like nailing things, and really you're becoming the stakeholder that you want to become in the space of healthcare. So cheers to everyone studying medicine. Don't be average, and
Exactly.
I think shoot for the best. So we're going to go right into what we'll be discussing today, and I'd like us to start with the term health advocacy. What does that really mean, and how does it really influence public health?
Okay. I think will I say layman's terms or paraphrasing, I'm not giving a definition. When we talk about healthcare advocacy, we're talking about series of events or activities that influence a person, a family, or a community, especially as regards healthcare. Now, a healthcare advocate is someone who is lending their voice, their time, towards championing the healthcare rights of others, of themselves and that of others. That's firstly, you're championing rights, helping people realize what their rights are, and then representing them, where it's needed. Then also as a healthcare advocate, part of what you do is to help build capacity towards community care, community-centered care, because healthcare advocacy is about everybody, whether you're elite, whether you're in the grassroots, whether you're middle class. So you are helping build capacity of both individuals, healthcare systems, healthcare bodies, also talking about primary healthcare center. You're helping build capacity to make sure that our healthcare centers or healthcare communities should be what they need to be. And also people are able to access them when they can. That's part of the work. Then I think thirdly would be policies. So as a healthcare advocate, you also champion and you're an active player in writing policies, and not just writing, pushing policies. So you might not be the author of a particular policy, but then you're lending your voice towards the actualization, or implementation of certain policies that are going to help the healthcare system at the end of the day. So I think a healthcare advocate at this point, everyone should be a healthcare advocate as long as you need healthcare services. In some way, either you're educating people, you're talking to your family about things, you're talking to your counselors, you're talking to whoever has access towards making something happen.
Yeah.
Once you're doing that, I think you're a healthcare advocate. But in the general or in the public light, while we have people who are consistent with it and people who are known for it. So they are the ones people generally call healthcare advocates. Yeah.
I mean, this has brought a lot of things to light, and really, I would say advocacy is like something that is at the core of policy making, because without advocacy, I doubt there would be a way to. And also, what you've said again points me in the direction of advocacy brings a change.
Yes.
So you're not just advocating and letting things fall to the wind. There's this particular thing that you want to see happen, and you are
following up.
Exactly.
With it.
You're following up on it. So I'm going to be asking the next question is, you've said that it's important for a lot of people, or for us to be healthcare advocates. But then, why is it important? I know you've said a couple of things, policy making, but are there more advantages to why it's important that we continue to advocate for causes in healthcare?
Okay. I'll answer that this way. Is healthcare important? I think that's the right question. Not that yours is wrong. I mean, that's the question that should be on everyone's mind.
Yeah.
Is healthcare, or how important is healthcare to you? Are you ever going to need healthcare services? Are you ever going to fall sick? And I think the answer is, it's like a rhetorical question, actually. Yes, at some point in our lives, we're going to require healthcare services. And as I like to say, no matter how bourgeois you are, no matter how elite you are, no matter how much you think you might have, and you feel like, okay, I can escape the decadence in our healthcare sector here in Nigeria, there's a word that is really popular, but it's humbling. It's called an emergency. Now, an emergency is restricted or bound by time. It works with time. And so when you have an emergency, you need urgent treatment. Do the facilities here in Nigeria, which is where we're resident, are the facilities here adequate enough to give you or to protect you
from that emergency?
Yes, when you're in that kind of situation, in that emergency situation, that emergency health situation where you need help urgently. Now, if you know that Nigerian healthcare system is something that can benefit you, you would require at some point, then that shows you how important it is for everyone to speak up if anything is wrong in our healthcare sector. So I think healthcare advocacy, if anything, it's underrated. It's not even emphasized enough. We still need more people to talk. I think because, as I said, they've seen a select number of people as the healthcare advocates. So people just feel like, I get some comments like, Dr. Sobo, you've not talked about this. Have you seen this? There are sometimes, we all have personal challenges. We all have our own busy times and busy schedules. And now because people feel like you are the messenger, you are the one we are seeing, they forget that they also have a voice.
True.
So that's why I said everyone should be a healthcare advocate. Everyone should be speaking up. And if you're keeping silent about things that matter, you're also speaking up without knowing. You're saying one thing, I am not interested. You're saying one thing, anything can happen. You're speaking. Your silence is very loud. So healthcare advocacy is very important in Nigeria and beyond. It's something that reshapes communities, reshapes the system, helps people live healthier lives, because it's all encompassing. It's not just about fixing.
Yeah.
It's also about maintenance. It's also about teaching people preventive health care, how to manage their lives, so that you don't get to that point where you need a kind of attention, medical attention that is not accessible to you. And also letting people know this exists. It is for you. This is where you can find it. So I think that's is saving lives.
Wow. Thank you. So one thing I got from that again is that problems are like ticking bombs.
Yeah.
And when you don't talk about it, one day they explode.
Exactly.
And so let's speak up. I'm tempted to say the word Sorosoke.
It's important to.
But yes,
we have to Sorosoke in healthcare. It's very important. Yes.
Please speak up. And then I don't want to generalize, but I'll say that Africans generally tilt towards a certain way, like certain terms, the way you should talk to them, and things like that. Or maybe it's not Africans, maybe it's like a particular people. And looking at healthcare, a lot of people say, oh my God, it's boring, it's boring. I rather watch something that would make me laugh.
Okay.
Or something.
Yeah.
So how do we, and I've seen a couple of your reels, a couple of your videos. I mean, I forget that you're even talking healthcare. I forget. I'm just like, oh, wow. It's interesting. You've passed the information. So what skill, how can we make healthcare more interesting? How can we be more engaging? How can people be interested in what many healthcare experts have to say without like, oh, that's boring, I don't want to listen to it?
Okay. I think that's a very good point you just raised there, Loretta. When I was in medical school, and I started discovering some things about medicine, about healthcare, health became so fascinating for me. I always tell people that, I'm able to talk about some things. I'm able to make medicine interesting. I'm able to convey the message mostly because I understood it. And I still understand it. So any subject I am teaching or any information I'm passing across, I first absorbed it. And that information or those information that I got were very interesting to me. Sometimes I'm in class, I'm like, how did I not know this? Like, do people know? Back in school, I beg, people need to know about this. What do you mean that cervical cancer is preventable? And people are dying. They need to know. But then you watch the TV programs, the traditional media growing up. And once they say it's a health program, let's be honest, I'm switching channels because the while you are talking, you are not communicating. You are rather interested in satisfying your personal, let's say, it's like self-gratification. Like, I came here and I gave it to them back to back. I nailed it. You just come out to say, pan of thermophilia, and everybody's like, hey, you're like, yeah, dog, speak loud, and you're feeding yourself. But then health education is not about feeding yourself. It's not about making yourself feel like, I really remember this thing. No, it's about helping the next person. It's about communicating. So one thing that we've not been getting right as regards health communication is actually being clear, giving out clear, succinct messages, and also giving out. There are different, I call them the C's of communication, health communication. It has to be clear, it has to be culturally sensitive. The way I would deliver, the way I would talk to you right now, the way I would deliver a message to you will definitely be different from the way I'm going to deliver it to some women who are in, maybe let's say Lagos mainland here. When you're going to low to middle income communities or going into underserved communities, sometimes I don't speak Yoruba, for example. Now, if we have an outreach in a Yoruba community, we're definitely going to have a volunteer who speaks that language, or Hausa or Igbo. There's a reason. Firstly, you make them relax. You make them feel like you're one of them. Talk to them in a language they understand. Don't be too fast to rap. Make sure they are understanding you. So you have to be clear. You have to be culturally sensitive. Also, you have to make sure that whatever it is you're passing across to people is very relatable. So that's where what I'm doing is, it comes in. So what do people want to hear? What is attracting people's attention? Where is their attention going? Okay, now the attention is going towards TikTok videos, Reels and Instagram, people just want. And then, of course, while this is happening, one thing I'm learning is that people's attention span is decreasing because people know how to pass a whole message in 30 seconds, in 60 seconds. So how do we break down these messages into digestible bits so that people can. So one thing I think a lot more healthcare advocates and doctors, nurses, healthcare practitioners generally should adopt is learning how to be patient when passing information. Make it relatable and break it down into bits that are digestible. Remember that your audience they wouldn't be your audience if they were in your class. So your audience, they are people they are everyday people who need the information. So use relatable events, to make them, understand what you want them to, capture, that message you want them to grab. Use relatable events. Nigeria, there is always an interesting thing happening. And then another thing is storytelling. You can never, overemphasize the power of storytelling. Share your experiences, share the experiences of people. People like gist. We all like gist, we like gossip. Let me gist, you see what happened. So when you can use those kind of events, relatable within the context of medical ethics, to pass those information, then you're good.